Thank you so much. I am delighted to be here with you at this 14th Annual Health Disparities Research Symposium. I must admit that I'm actually pre-recording this earlier because as you hear this, my husband is having major surgery, so all prayers up. I'm sure that it's going to go well. But that means that I also will not be available for question and answer afterward, but we'll have plenty of opportunity during the remainder of my time as the presidential chair here at UCSF. So I have entitled my remarks, Anti-Racism Research Agenda, from documentation to intervention, from naming racism to moving to action. And I'll tell you a little bit about the trajectory of my work. As many of you know, decades ago, I started out interrogating race, the variable race, and what did it measure and why were we so, routinely documenting race-associated differences in health outcomes. And so some of that work included examining the use of race in the epidemiologic literature. Some of it included making recommendations to epidemiologists on distinguishing between race and racism in the practice of epidemiology. So I started out as a family physician and epidemiologist, really understanding race is not biology and moving to racism. And then in my work on racism, I started my storytelling, my allegories on race and racism. So my Gartner's tale, with which many of you might be familiar, I gave out my first definition of racism. Well, in the Gartner's tale, I talked about 3 levels of racism and our need to address structural or institutionalized racism if we're going to set things right in our society. And then afterward, I provided a more global definition of racism that I will share with you today. But my work on racism continued. I even started proposing new ways of measuring racism by understanding race as socially assigned race. I even started saying, yes, and we in the health professions need to address racism. That is not for the sociologists or educators or other people. And I even started expanding my definition of racism, generalizing it to be a definition of any system of structured inequity. So a huge bulk of my work in the middle part of my career had moved from race to racism. And then I moved from racism to anti-racism because as important as it is for us to name a problem in order to be able to address it, that is, we must say the full word racism, we must also move to action. And so the action is anti-racism. And so when I was president of the American Public Health Association in 2016, I launched our association on a national campaign against racism. And in that, I had a year full of columns, 10 monthly columns in 2016, which you might be interested in reading. And I also published toward the science and practice of anti-racism, launching a national campaign against racism, where I won't have time to share with you today, but where I describe an anti-racism collaborative with 8 collective action teams. And now, in the midst of anti-racism, as UCSF is, as an institution, as many of you have been for over the whole course of your careers, and some of you are venturing, becoming maybe health equity tourists. Well, that's all right if you learn enough, if you're partnering with community, if you're partnering with colleagues. But what I have come to recognize in our anti-racism work, that the anti-racism work is not just recognizing the structures and dismantling the structures, but also taking into account the barriers to our work. That is, proper anti-racism would have predicted perhaps that after a President Obama would be a President Trump. That is, we have to anticipate the barriers in our way. And one of the huge barriers in this nation is racism denial. And we must confront that racism denial. I have come to understand racism denial as the big black hole in our universe. In this country. A black hole in the universe is called that because you can't see it, but it's so massive. And in fact, the reason you can't see it is it's so massive that when light gets anywhere near it, it sucks it in. And racism denial is the black hole in our US setting. And so in that, I have started now by identifying roots of racism denial in our Western culture. I used to call them 7 barriers to achieving health equity, 7 social barriers, cultural barriers. And I actually won't have time to share those with you today, but I really encourage you to look at this blog where I talk about where of these 7, there are 4 of them that are absolutely the roots of racism denial. And I actually think that what we need to do as part of our anti-racism work is to interrupt the intergenerational transmission of racism denial. So that is my preamble. But I wanted you to understand that because the same progression, the same trajectory in my work, many of you have experienced, it's also a trajectory of our fields. And it is very important, I think, for all of us to go through those stages, but to recognize that it's not enough to document race-associated differences. It's not enough to document racial health disparities, and even to document the impacts of racism on the health and well-being of the nation. What we must do is intervene. We must move to action. We need, instead of treating racism in our anti-racism research, something like the US public health study of untreated syphilis in the Negro male, commonly known as the Tuskegee study, but treating it like that, where we're just documenting the heck out of the natural history of the impacts of racism on health. Instead of doing that, we need to bring in some penicillin. We need to intervene. We know what can help in many levels. And actually, at the most basic level, it's going to be intervening with infusion of resources. What we need to do is to go beyond documentation, from documentation to intervention, in all of the ways that we know how to intervene. So now, this is where I might have normally started a talk. So here we are, but that's my preamble. And I think if you understand that, you understand that all of the work is good, but if we just stay in one thing about documenting without thinking about intervention and without bringing together all the resources for intervention, then we're doing a Tuskegee study on racism. So as I mentioned, in 2016, 5 years ago, when I was president of the American Public Health Association, I launched our association. And as many community partners, local public health associations, conversations with the American Medical Association, National Medical Association, as many of us as would join in on a national campaign against racism with 3 tasks. The first, of course, is naming racism, because you must name a problem in order to be able to address it. But as important as naming racism is, it is necessary, but insufficient. So we must move to action. The second of the 3 tasks is asking, how is racism operating here, to identify levers for intervention, targets for action, laying out the landscape. But even that is insufficient, that descriptive work. The third task is to organize and strategize to act. Of course, individual action is good too, but real power is in collective action. So over the next, maybe now 35 minutes that I've left for myself, I am going to share with you some tools, just a little smidgen of it for each of these 3 tasks, really understanding that here we are at a health disparities research symposium. Let me say that out of my national campaign against racism in 2016, it launched the first of what are now 217 local jurisdictions, so city councils, county commissions, states at some level across 41 states that have made formal declarations that racism is a public health crisis. You may know that the CDC director made such a declaration this past spring. You may know that the American Medical Association made such declarations last fall, a year ago, and that the American Public Health Association from back in 2016, and in our policy statements from way back in the day, right? This is good. But again, as we look at naming racism and then moving to action, I encourage you to go to the American Public Health Association website, to go to their map where they're looking at and documenting all of these 217 declarations across 41 states. click through and see, is the declaration associated with money? Is it associated with new policy? Is it associated with investment or inviting people to decision-making tables or going into community decision-making tables? We need to look at that. And even if it is just a declaration saying we recognize that racism exists, please hold us accountable. I also want to share with you 4 key messages, even at that level, that I think all of us must have. The first key message is that racism exists because, as I've just told you, racism denial is staunchly held by many in this nation. Not only does racism exist, racism is a system. Racism saps the strength of the whole society. And yes, we can act to dismantle racism. So if you don't remember much else of what I'm going to tell you, I hope that you can hold on to these 4 key messages, because these are the key messages that you should have with your colleagues and your family members and neighbors and children and all of that. But they also might be 4 key messages that help you organize your research directions. So I'm going to share with you just one of my allegories today. And this one is the one that I use when I have just a few minutes to help a group of people understand that, yes, racism exists. Now, what do I mean by allegory? Well, I have developed so many teaching stories to help people understand so many messages about racism, most of them based on something that I saw with my own real eyes. The story that I'm going to tell right now, which has the moral, racism exists, I call Dual Reality, a restaurant saga. And it was based on my experience as a first-year medical student, when one Saturday, like most Saturdays, I had awakened early, hit the books because I was very studious, very diligent. It was about mid-afternoon. I was head in the books. Some of my friends came over. And did they distract me from my studies? Oh, no. Oh, no. We all got to studying long and hard. And by now it's getting late and we're getting hungry. And I have no food in the apartment, which was so typical that my friends understood. And they were like, okay, never mind, Camara, we understand, but we're hungry. Let's go into town and find something to eat. So we do. So we walk into town and we find a restaurant and we walk in and we sit down and the menus are presented and we order our food and the food is served and here we are eating. So maybe not the story you thought I was going to tell about racism and a restaurant, but hold on. As I sat there with my friends eating, I looked across the room and I noticed a sign that was a startling revelation to me about racism. So now maybe I've intrigued you and you're wondering, well, Dr. Jones, what did the sign say? Oh, well, what did the sign say? The sign said open. So now maybe I've lost many of you. So let me recap. How is this about racism? Let me recap. Here I am sitting with my friends at this table eating. I look up and I see a sign that says open, and thinking no more about it, I would assume other hungry people could walk in, sit down, order their food and eat. But because I knew something about the two-sided nature of those signs, I recognized indeed that the restaurant was closed due to the hour, but firmly closed, and that other hungry people, just a few feet away from me, but on the other side of the sign, would not be able to come in, sit down, order their food and eat. And that's when I recognized that racism structures open, closed signs in our society. That racism structures, if you will, a dual reality. And for those who are sitting inside the restaurant at the table of opportunity eating, and they look up and they see a sign that says open, they don't even recognize that there's a two-sided sign going on, because it is difficult for any of us to recognize a system of inequity that privileges us. So, for example, it's difficult for men to recognize male privilege and sexism. It's difficult for white Americans to recognize white privilege and racism. In fact, it's difficult for all Americans to recognize our American privilege in the global context, except that we're living it really large right now with how much of the global supply of COVID-19 vaccine we have sort of sequestered in this nation. Those on the outside are very well aware that there's a two-sided sign going on because it proclaims closed to them, but they can look through the window. and see people inside eating. So back inside the restaurant, to those who ask, is there really a two-sided sign? Does racism really exist? I say, I know it's hard for you to know when you only see open. In fact, it's part of your privilege not to have to know. But once you do know, you can choose to act. So it's not a scary thing to name racism. It's actually an empowering thing to name racism. It doesn't even compel you to act, but it does equip you to act so that if you care about those on the other side of the sign, which is an if, but if you do, why you could even talk to the restaurant owner who is, after all, inside with you. And you could say, restaurant owner, there are hungry people outside. Why don't you open the door and let them come in? You'll make more money. And oh, the conversations we could have. Or maybe what you'll do is pass some food through the window. Or maybe you'll try to tear down the sign or break through the door. But at least what you won't be doing is sitting back saying, wonder why those people don't just come on in and sit down and eat. Because you'll understand something about the two-sided nature of that sign. So when I have just 5, 6, 7 minutes to share with a group of people, an image that will help them understand that, yes, racism exists. This is the story that I tell. Racism is structuring a two-sided or multi-sided sign. It is creating a dual or multifaceted reality. And actually, I have started a 3-hour conversation on 2 different occasions with the following question. How could people who were born inside the restaurant know something about the two-sided nature of that sign? And each time it was a 3-hour conversation because there are many ways to know. So I hope you remember this story and maybe start that conversation with your colleagues or your students or your faculty members or your friends, neighbors, family members. I do want you to remember this story. But before I finish with it, let me just say one more thing. I am actually pleased that there are many people who were born inside the restaurant who have a sense that there's something, going on about the sign. There are people who maybe 18 months ago might have been sitting inside eating and saying, well, what do those people outside say? Black lives matter? Don't they know all lives matter? Who are now affirming, yes, Black lives matter. There are more people who were born inside the restaurant who are saying the word racism, putting together the phrases structural racism, systemic racism. This is important. This is UCSF. It's the rest of the nation, right? Well, not all the nation, because there are many people who don't want to, there's a whole anti-critical race theory movement. Okay, that's another whole conversation. But there are more people who are understanding that. But here is my warning. If we just say a thing, if we just put a statement on our website or on our individual Facebook pages or tweet something out, if we just name racism, 6 months from now, we may forget why we said that thing, because racism denial is so staunchly held and so seductive that 6 months from now, we may fall back into what I describe as the somnolence, the sleepiness of racism denial. So we have to go beyond naming racism to action. We need to tear down the sign. And of course, racism is not just a sign. It's a sign, it's a door, it's a lock. We need to dismantle the lock, take the door off the hinges, because once we start acting, we will not forget why we are acting. So I know I owe you a fulsome definition of racism. So here is my definition of racism. And first of all, I'm clear every time I say the word racism that I'm talking about a system. So I'm not talking about an individual character flaw or a personal moral failing or even a psychiatric illness, as some people have suggested, even though racism can show up in those ways. But in its essence, it's a system of power, and a system of doing what? A system of doing 2 things, of structuring opportunity and of assigning value. And on what basis is the opportunity structured, and on what basis is the value assigned? It's based on so-called race, based on the social interpretation of how one looks, which is what we call race. So again, remembering some of my trajectory and maybe reading some of my papers, you can get some more insight on that. I'm not going to have time to go deep. But what are the impacts of this system of structuring opportunity and assigning value based on socially assigned race? Well, when we do recognize that racism exists, in this nation, then we usually get to the aha that racism is unfairly disadvantaging some individuals and communities. But it shouldn't take any of us long to recognize that every unfair disadvantage has its reciprocal unfair advantage, so that racism is also unfairly advantaging other individuals and communities. And that's the whole issue of unearned white privilege that we hardly ever talk about in this country, because it makes some people, especially some people who are living as white, uncomfortable. And, you know, I've been doing this work for decades, as you have seen. And in this work, you know, especially if I was in a room and I saw people start to fidget when I would get to this part of my definition, I actually used to almost apologize. I'd say, well, if you feel uncomfortable, shake it off, stay with me, I'll tell you more stories. I don't apologize anymore. What I say now is, if acknowledging that racism unfairly advantages some individuals and communities, to acknowledge unearned white privilege, if that makes you feel uncomfortable, I encourage you actually to lean into that discomfort. Read some history, go across town and stay a while, because I have come to recognize that for all of us, the edge of our comfort is our growing edge. But there's a third impact of racism that many of us miss, and that is that racism saps the strength of the whole society through the waste of human resources. And I tell you, I could stay on that point for another 10 minutes. I will not. But I encourage you to understand that when we don't vigorously invest in the full, excellent public education of all of our children, because some blinders have made some decision makers think there's no genius in the barrios, the ghettos, on the reservations, we can get along very well, thank you, without those kids, when of course there is genius in all of our communities. And if we were only to vigorously invest in all of that genius, we could be doing so much better as a nation or a world. Or when we are complacent with the wholesale warehousing disproportionately of so many Black men and brown men and women in our prison system, as if that didn't separate us from human potential. We could have a whole long conversation about how racism saps the strength of the whole society through the waste of human resources. I actually think that that impact of racism needs more attention these days. We need to have more media stories about that. We need researchers, more data collection demonstrating that fact. We need more conversations around our board tables and around our dinner tables, so that we have more people filled with a sense of urgency to dismantle this system and put in its place a system in which all people can know and develop to their full potentials. Before I leave this slide, I do want to say that when I was at the CDC for 14 and a half years, the last little bit of my time at the CDC, which is why I left the CDC, I escaped, I was in a new part, and in that area, they felt that CDC should not be addressing racism at all. But if it was, it certainly shouldn't be in that division. And when I presented this slide, I was instructed that I needed to take that second point about how racism unfairly advantages other individuals and communities off of my slide. And when I resisted, then the compromise was, well, if I took the words unfairly off of the first 2 points, then maybe I could keep them. Well, that interaction taught me a lot. It taught me a lot about our whole nation, because actually I think that if you ask many people, they would say, yes, there are 2 states of being, but they would describe them as disadvantaged and normal. And the reason that many people would describe these as disadvantaged and normal is that we are ahistorical in this nation, and people's so-called normal, they don't recognize, is built up on a whole mountain of unfair advantage. I will not have time to share with you my Gartner's Tale allegory. I know many of you may have read that before. Many of you may be teaching it. It's about 3 levels of racism: institutionalized or structural, personally mediated, which some people call interpersonal, but because I know racism is a system, I describe it as personally mediated because it's a system mediated through people, and internalized. I highly recommend that you either get the paper or that you go and watch this 18-minute video. The production value is very 2002. It's almost 20 years old, but the story and the description of the levels of racism are right there, and it is still the same. So I'm not going to go deep in that, just to say that the moral of that story is that if we want to set things right in our garden, we must address structural racism. And when we do, the other levels may take care of themselves. And furthermore, when I defined racism as a system of doing two things, of structuring opportunity and assigning value, we must address both of those, because even if we were to compel that red gardener to enrich the poor rocky soil in which the pink flowers have been placed, if we were able to compel that red gardener to enrich that poor rocky soil today until it was as rich as the rich fertile soil, if she continues to prefer red over pink, she will continue to privilege red over pink going forward. So for many years, my story, and maybe the way it's published, I haven't read it in a while, is about opportunity structures primarily, but actually racism does two things: structures opportunity and assigns value, and we must address both if we're going to set things right in the garden. I want to shift gears for just a moment, because here we are, health disparities researchers, to say that I have identified three different dimensions of our science, and there are holes in our science. So I just described that I have this, these three levels of racism: institutionalized or structural, personally mediated, and internalized. And I would point out that most of the research on racism in health is at the personally mediated level. But it's not just the level of racism. It's also true that we could have different kinds of measures. So we could measure institutionalized racism at the individual level by measuring individual income or education, personally mediated where you treat it worse than, internalized, the doll study, for example. But we could also measure aggregate measures of each of those levels of racism. So an aggregate measure of institutionalized or structural racism might be differences in the distribution of income or education by race. Aggregate measures of personally mediated racism might be reviews over 6 months of an individual clinical practice or of a hospital system to see, is there something differential going on here by race. Aggregate measures of internalized racism might be actually looking at hierarchies, even within stigmatized racial groups, where, is there a light skin stratification in terms of power or prestige or elitism. So not only do we have the three levels of racism, we have two types of measures, but then there's a third dimension. Let me just say, so not only is most of the work that we do personally mediated, it's personally mediated at the individual level. We have not developed sufficient aggregate measures of any of those levels of racism. But the third dimension for holes in our science is the nature of the impact. And you will remember that I just defined racism and talked about it having three impacts. It unfairly disadvantages some individuals and communities. It unfairly advantages other individuals and communities, and it saps the strength of the whole society through the waste of human resources. And I would say we have completely, at least in this day and age, neglected, well, one of my papers, our paper that we have in Ethnicity and Disease in 2008, does take a look at unfair advantage by socially assigned race. And there are other people who have done that over the time. But for the most part, we are stuck in the unfair disadvantage plane without paying sufficient attention to the unfair advantage and without hardly ever measuring how racism is sapping the strength of the whole society. So as I say, there are many, many holes in our science. And so I encourage you to think about expanding your research agendas. All of that was about naming racism. I have just a few minutes left where I'm going to talk about the second and then the third of the three tasks of a national campaign against racism. The second is to ask this question: how is racism operating here? And that is a legitimate question, because racism is not a cloud or a miasma that we can't get a handle on. It is a system with identifiable and addressable mechanisms in our structures, policies, practices, norms, and values, which sounds highfalutin until you recognize that actually those things are the elements of decision-making. Structures are the who, what, when, and where of decision-making, especially who's at the table and who's not, and what's on the agenda and what's not. And actually, whenever you find yourself at a decision-making table or set one, I encourage you henceforth, as your first order of business, to take a look around and ask yourself and others who is not here at this decision-making table who has an interest in this proceeding. And then your job is not just to represent their interest, although you might have to do that short term. Your job is actually to create space, to find them a way to the table. And if structures are the who, what, when, and where of decision-making, policies are the written how of decision-making, and we need to examine the policies that are on the books, but also think about what policies are not there that, if put in place, could have a social justice impact. And then if policies are the written how of decision-making, practices and norms are the unwritten how of decision-making. Practices are how we do things today. Norms are how we have always done things or how we are expected to do things, both unwritten and therefore a little harder to get a handle on. Values are the why. And so I actually encourage us to take this question, how is racism operating here, with us everywhere? How is racism operating here in my child's daycare, in my workplace, in my classroom, at UCSF? How is it operating here in San Francisco? How is racism operating here with regard to police killings of unarmed Black and brown men and women? How is racism operating here with the underrepresentation of people of color in research? How is racism operating here with the disproportionate impact of COVID-19 on communities of color? And I thought I would just give you one example of how you could take this question and use it to identify some candidate levers for intervention, targets for action. So how is racism operating here in a generic academic health system? Well, with regard to structures, which are the who, what, when, and where of decision-making, it includes limited diversity of perspectives and lived experiences on boards of directors and in top leadership. Now, I know we're doing pretty well at UCSF, but for how long has that been? And is it at all levels of power? I mean, is that true also for the chairs of departments and the like? I don't know. With regard to policies, insurance status or insurance provider as gatekeepers, even for access to the healthcare system, or using crisis standards of care to triage people if we come to where we have to throw all bets are off in terms of the usual physician or provider patient relationship. And now we have one ventilator and 3 people who need it. And who are we going to give it to, or who are we going to take off the ventilator to give it to somebody else? All of that. When those triage standards include the existence of pre-existing health conditions like diabetes or hypertension, which are disproportionately impacting communities of color because of racial residential segregation with disinvestment and environmental poisoning and all the like. I mean, you see, I'm going very deep on this slide, but when we do that, we are writing racism into our policies. Practices. So the practice of having, and I don't know UCSF, this is a generic academic health system, but having a teaching service versus a private service, or the practice of see one, do one, teach one. When I was in training decades ago, that's what we did. Really, is that what you want to happen to your mother when she's in the hospital? Or even the training hierarchy that mutes whistleblowing. When a younger trainee sees something wrong or hears something wrong or witnesses something, but they don't feel that they have the standing and the protection to bring that to the attention of the person who did it or anybody else. The norms, where we focus on individual medical care rather than a community health context, which even has implications for COVID-19 and how our nation kind of missed the boat and how to treat that. We were treating COVID-19 as if it were an individual medical care problem as opposed to a public health problem. And that individual focus on testing and masking and all of that made it a huge medical care problem. If we had addressed COVID-19 properly as the public health problem that it was, we would not have and still would not be overwhelming so many hospital systems as we are today. And also the fact that in most places, there's not routine review of individual provider practices. But we need that if we're going to say, is there something differential going on here by race? And values. Now, I told you I wasn't going to tell you, my 7 barriers to achieving health equity, which are the 7 values targets for anti-racism action, but here are 3 of them. Our narrow focus on the individual that makes systems and structures either invisible or seemingly irrelevant. So, what do you mean racism is a system? System, what system? Why are we talking about systems? Our ahistorical stance, where we act as if the present were disconnected from the past. and as if the current distribution of advantage and disadvantage were just a happenstance. And our endorsement of the myth of meritocracy, the story that goes something like this: if you work hard, you will make it. Now, I give you that most people who have made it have worked hard. Not everybody who's made it has worked hard. We have some prominent examples of that, but most people who have made it have worked hard. But yet and still, there are many, many, many other people working just as hard or harder who will never make it because of an uneven playing field, which has been set in place and is being perpetuated by racism, sexism, heterosexism, economic systems like capitalism. All of these systems of structured inequity. And when we deny the existence of these systems of structured inequity, when we deny racism, then we are blaming those who haven't made it for being lazy or stupid. And there are many ways to deny racism. As I said, a lot of people taking the easy way out these days and flat out saying, I don't think racism exists. But there are others of us who are staunchly doing the work of diversity, equity, inclusion, belonging, social justice, anti-oppression, health equity, cultural competence, cultural humility, structural competence, racism. No, oh no, we don't ever say racism. That's the point. We might talk about race, but if we talk about all of those things and we never say the word racism in our national context of widespread racism denial, then we are complicit with that racism denial. Well, these three values, along with white supremacist ideology, which I don't have there, are underpinning those four things. The three I listed here and white supremacist ideology are the roots of racism denial in our nation. And we need to figure out how to address those. Is it going to be the clergy that addresses that? Are schools? Is it, PSAs? What do researchers have to do with it? Do we have to just let those who have these values kind of age out while we interrupt the intergenerational transmission of racism denial? Many ideas, a lot of conversation around that. And also comfort in the status quo, which is a value. You can see I'm talking long, but comfort in the status quo, I think, is at odds as a value with social justice as a value. And I really think there's a huge wall between them, which might have an open close sign on it. Comfort as the status quo, or comfort in the status quo. If you value comfort, then when you get to the edge of your comfort, you recoil. You don't want to lean in and understand that the edge of your comfort is your growing edge. And it's usually because the status quo is comfortable for you. It is benefiting for you. On the other hand, those people who are interested in social justice usually have seen that there is something uneven going on, that there's this wall, that there is a two-sided sign. Many of them actually are on the outside. There could be some people on the inside who ventured outside and recognize it, and now recognize that we have to do something about social justice. But actually the tension between those two things as values is something else that I am starting to think about and will do some work in. But what can we do today? In closing, going back to my image from the dual reality restaurant saga, what can we do today? Well, we need to actively look for evidence of two-sided signs. We need to actively look and ask ourselves, is there something differential going on here by race, by gender, by immigration status, by language, by nationality, by zip code, by religion, by urban, rural, by any socially defining chasm between groups of people? And as we look for these evidence of two-sided signs, we need to look not only at outcomes, but also at opportunity structures. We cannot be comfortable looking up and saying, oh, it looks open to me. So that's the first. But we have to go beyond that. We need to burst through our bubbles of experience to experience our common humanity. So each of us lives in a bubble of experience. If we have kids, or our parents, or our neighbors, our work, our social community, our religious community, whatever. And some of our bubbles are quite large, and maybe they have thin soap bubble boundaries. And some of our bubbles are smaller, and they might have thicker plexiglass boundaries. And some of our bubbles are tinted, and some of our bubbles are polarized. But whatever kind of bubble we're living in, most of us do not know that just across town, there are people who are just as kind, funny, generous, hardworking, smart as we are, who are living in very different circumstances. We need to create, as individuals and as an institution, bubble bursting opportunities so that we can experience our common humanity on the other side of town, because when we experience that common humanity, we can start building common cause. We need to be interested in the stories of others, believe the stories of others, and then join in the stories of others. And I am heartened that we as a nation have been doing that over the past 18 months without requiring cell phone video documentation or body cam footage when people talk about their experiences. We need to develop a sensitivity to the absence of. So who's not at the table? What's not on the agenda? What policies are not in place? And that's a very important sensitivity. It doesn't come easy. Most times people are just scanning the room for what's there and they actually miss what's not there. Finally, we need to reveal inaction in the face of need, because inaction, lack of action in the face of need, is how structural or institutionalized racism very often shows up these days. But let me say, all the power is not just sitting right there among those who are on the inside of the restaurant. Those of us on the outside need to know our power. We need to recognize that action is power, and especially that collective action is power, because collective action propels us, it informs us, it inspires us, it protects us. So I encourage all of you all in your research and beyond. Yes, we need the documentation, but we need to move to action, and collective action is power. Thank you very much.